Do you feel like you have eye pain? Well, I can definitely relate to that. Hi, my name is Peter, and I'm diagnosed with steroid-induced glaucoma. Today, I just want to cover a video about the medications, the dosage of what I use, and some tips and tricks that I do to make it easier on myself and some other tips that can be easier for you. So let's just get started about some of the medications that I use for my glaucoma and my personal experience. So when I was first diagnosed with steroid-induced glaucoma, they introduced me with two medications for glaucoma, and that was brimonidine, and the second one was Cosop. The other name would be dorzolamide timolol, and the dorzolamide timolol I would do twice a day, and the brimonidine I would do 3 times a day. I was introduced to 2 medications. I have the medications with me right now. They are right here. These are the medications I have right here. This is the one I have. If you can see, if I put it, if you can see, I have this one, the brimonidine, and then I also have the dorzolamide right here. If you can see it, I don't know if it's focusing on camera, but these are the 2 medications that I use for my eyes. And with these medications, they help relieve the pressure and lower the IOP. And when I would forget my eye drops, that really what set me into having the off-mid shunt surgery. So it's very clear you don't want to forget your eye drops, because it's very important not to miss these drops, especially when you have severe glaucoma and your pressures are very elevated. So moving on to the next steps of other eye drops and what kind of tricks and tips we can do. So some other eye drop medication that I do use, that I am now currently on as I'm 25, including these 2 medication of brimonidine and dorzolamide, is that I am on the Tenapros and Ropressa. Here, let me close up to the camera if you can see that one. You can see this one. Let me see if it's focusing. Right there. Don't know yet. And this is the next one. I have Tenapros right here. If you can see it. Let's see if it's focusing. You can see it. I don't know if it's focusing. I'll have to check back. That's the other 2 eye drops that I do. So in total, I have 4 eye drops pretty much. Ropressa, Tenapros, brimonidine, and Cosop. 4 eye drops. However, I do take another medication, but it's not an eye drop. It's a pill. I take metazolamide. I didn't want to show that just because there are certain kind of pills, and it includes my name and address and all sorts of information. But I take 50 milligrams as my dosage twice a day. The Ropressa and Tenapros are done at bedtime. So that is my current routine on eye drops. Some tips and tricks that I do to make it easier for myself is that sometimes I refrigerate my eye drops, especially my midnight eye drops, my Tenapros and Ropressa. I refrigerate them. Usually they are recommended to be refrigerated, because when I do pick them up at the pharmacy, they come refrigerated. So I just refrigerate them. However, they can be stored at room temperature, but it'll last about 30 days, so about a month. And when you do have eye drops refrigerated, it lets you know that you can feel the eye drops going into your eyes. That's just one tip and trick. And some other things that happens if you do forget your eye drops is that whenever you're forgetting your eye drops, it's okay. If you do miss the dose in the morning, try to get it as soon as you can. Say my eye drops are typically due at 7 a.m., 8 a.m., 9 a.m. If I miss it around there, I would just do it around 10 a.m., 11 a.m., or 12 p.m. I would do it immediately as soon as I remember. But if you really totally forgot and it's already at your next eye drop, that's fine. There's no point in double dosing, because your eyes can only absorb it once. But as soon as you remember, just do it immediately, the eye drop. That way you can get it and to make sure your eye pressure stays lower. So that's another tip and trick that I do, and something that I want you not to forget when you're missing your eye drops is always stay on time and just do it as soon as you remember if you miss your drops. However, if you do miss your drops more frequently than 1 time, 2 time, 3 time, definitely call your doctor and see what to do next, because there are different protocols to do. Because when I was younger and I missed my drops, it was terrible for me, and that's when my pressure got elevated and I needed to get immediate shunt surgery. So I highly recommend do not forget your eye drops. Now I take my vision very seriously where I don't want to forget it. Sometimes I do forget it, maybe a couple hours, but that's not too bad. I usually just do it as soon as I remember. And if you do stay up in the night, say past your bedtime eye drops, still do your bedtime eye drops, but then cycle the other eye drops that you would normally do, like brimonidine, in the middle of the night, and the COSOP, because they're normally done like about 3 times a day to brimonidine. So just split that up into the night and the COSOP every 12 hours. So make sure you're doing everything cohesively. So those are all my tips and tricks and my medication and dosing. If you do find these helpful, please let me know and drop them in the comment down below. And I do want to mention as well, if you do have any of these eye drops, make sure to get them preservative free. Preservative free, because if you don't get them preservative free, you will get dry eyes. All these eye drops that I showed you contains preservatives except the COSOP. You saw how the COSOP was in a bag? Yes, those are preservative free drops. They come in like little tear packets, as you can put them in your eyes really quickly. Preservative free drops lessen your eyes being dry, and when your eyes become dry, that's when your visions become worse. So please try to get preservative free drops, and that's what I recommend too. And if it's too late to get preservative free drops, get some teardrops to make sure your eyes don't get worse or any more drier than what it normally is. Some teardrops I can suggest is Refresh. A Refresh teardrop that I personally use is Refresh Plus. This right here, if you can see it, I use this. It's pretty, it's not expensive, it's affordable. I usually just buy a pack of this at Sam's Club because I can use it daily and often. With preservative free drops, you're able to use it multiple times a day instead of the regular ones that come in the bottle. So please get preservative free drops. So if you did found all these tips and helpful, and the medication dosage, and that last final tip about preservative free drops, please comment down below any tips that you have, and make sure to subscribe for more information and tips.